Hello, and welcome to the second Canadian Mental Health Voters League podcast. A couple of things I'd like to get to today. The first being just a question to Canadians, to anyone listening. Is healthcare a right? Been seeing a lot of news from the United States, our southern neighbors, about the healthcare changes that are being proposed. And I think a lot of it comes down to a basic question as to whether healthcare is a right, whether healthcare is something that tax dollars should go towards ensuring, whether tax dollars should go towards making sure people get the healthcare that they need. I think a lot of Canadians like to think that, we've answered this question, that healthcare is a right. But I think if you were to ask somebody who has been waiting 8 or 9 months to see a psychiatrist to address their problems, to address things that they're trying to get through, very serious things, whether you go to some communities that are experiencing serious drug problems, addiction problems. I think if you went to any downtown core and saw the number of people that our healthcare system has failed, begging outside of pharmacies that are stockpiled with medications that would change their lives. If you were to ask these people if they believed that mental health care was a right, they would have a different answer. Right now, our provincial budgets, our provincial healthcare budgets, are about 7% of total spending. That means 7% of our healthcare dollars are going towards mental health. When you compare this to other countries with public health care, like the UK, Australia, New Zealand, who are 11, 12%, this makes an enormous difference in the amount of spending that goes towards making sure doctors are available, making sure people can afford medications that they need, making sure that services are there in communities when those services are needed. When it comes down to it, political budgets are how politicians speak about their actual values. Politicians will talk endlessly about what they care about, what they think is important. But when you see that 7% of our healthcare dollars are going towards mental health, which is not even approaching a level where it should be, you can see where their values actually lie. We'll never eliminate mental illness, but we can work to improve the problems and the hardship that people go through when they experience a mental health problem. It shouldn't take years to get your life back on track the way it does now. We're seeing 2 leadership races in our federal government, the Conservatives and the NDP. And if you want to get involved to let these parties know that mental health care matters to us, it matters to Canadians, you can email us at questions@cmhvl.ca. We'd love to talk to people about how to express their concern, their personal experiences to people in politics, and to let them know that this is a serious issue and their jobs, their being elected, relies on us. Without our votes, these people won't be paid as politicians. So I think in the choosing of a party leader, it's crucial to imprint that this is a serious issue in the narrative of their leadership race. So I'd like to thank you for listening today. I look forward to delivering podcast number 3.